When you look at the investment you make in preparing for your career, it's significant.
I expect to be part of an integrated healthcare team where my contributions are recognized and valued.
I want to be in the most progressive professional environment possible. I want more.
Here, on Canada's West Coast, there's something very special going on. Something unique. Here, a leading employer in BC and Canada, with the highest, most progressive standards in clinical pharmacy, merges with an extraordinary setting to create an unparalleled opportunity for you. We are the Vancouver Island Health Authority, 18,000 employees serving nearly 800,000 Canadians in 11 sites across the island. Our commitment to the importance of and the advancement of the profession of pharmacy is a matter of record.
We have a different philosophy in VIHA, where we want our pharmacists on the wards, we want them seeing patients, and we want them interacting with the teams on the ward. Being on the ward on a regular basis rather than downstairs in the dispensary allows you to process orders from the floor, see patients when they need to be assessed. You can pop into a patient's room, help them understand their medications, which is how we improve patient care.
As a clinical pharmacist with the Vancouver Island Health Authority, you are part of a new paradigm, working in a model which fully integrates you into the interprofessional team. This model way of working is consistent across all 11 of our clinical settings. And at the operational level, hospitals across VIHA lead the way with a unit dose picking robot for patient-specific doses, and integrated cabinets for ward stock distribution, digital orders and order scanning, allowing pharmacists to verify orders from the patient care areas, pharmacy assistants and technicians working directly with the clinical pharmacists in order to facilitate increased time to work with patients and other members of the care teams.
The robot's name is Todd. What it does is it is a robotic machine that picks the medications in the dispensary downstairs, so it alleviates the technicians having to do that piece. It is linked with our computer system, so it realizes what medication orders have been verified by a pharmacist for a patient. I can verify orders from the floor, and then the robot knows to take those medications and put them in a little envelope for the patient.
Typical workday might be that I come in the morning and I'm greeted by a number of issues that need to be addressed right away. I consult in the ICU, I consult on the medical wards. Often we're stepping in where some sort of troubleshooting flag has come up for us. Meet with patients who are leaving in 10 minutes and need to know about their warfarin. It's an interesting pot in the morning. Anything can come my way.
We spend almost 75% of our time or more on the ward, and I think the other team members really see the value of what we're doing. When I sit in rounds, I get asked questions about what's going on with the patient, and when I have something to say, it's definitely taken to heart and considered, and people really respect and value my opinion.
Well, the big institution that I was at previously, my practice was very black and white and highly supervised. There wasn't a lot of flexibility in my role. We've been able to craft a pharmacy program, and that includes the clinical side, right from the ground up according to the way that we thought it would work best for our facility. And so I'm proud of what we've achieved within that. We are supported, but we are not directed.
I often find that upon interviewing the patients, perhaps they're not taking medications exactly as prescribed and maybe need some help with taking their medications at home. And I feel that's a really big impact I make as a pharmacist, is that transition, that seamless transition from hospital to community.
Senior administration knows what we do in VIHA. We've developed a clinical tracker tool which allows us to actively report the wonderful work that pharmacists do up to senior administration so they can have a better appreciation of how vital the pharmacy department is to the care that patients receive on Vancouver Island. The strength of our department is greater than the sum of all the individual parts of it. We've worked very hard to build a strong, cohesive, solid department where people are very excited to come to work every day. The leaders in the pharmacy department are always available to mentor and support our staff in whatever capacity they need.
If you're about to graduate or are a recent graduate, here are the unique benefits of working on Vancouver Island as part of the VIHA team. We offer an exceptional pharmacy residency program. 1 year of clinical training in which you will have the opportunity to get to know people here and move seamlessly into a satisfying role post-residency.
I really wanted to move on Vancouver Island, and I thought that coming to work for VIHA was a really good opportunity for me to come and work on the island. There are different positions as pharmacists, so I can go from pharmacist grade 1 and then you can be a clinical pharmacist. So it's really interesting that you can move forward.
I'm originally from Alberta, and when I graduated, I applied for a residency position with VIHA, and I was successful. Came out here, fell in love with the island, and decided to stay.
We're also committed to ongoing professional development, sending our pharmacists to courses and seminars to increase the skills and knowledge they will need to improve the quality of care we provide to our patients. If you're a seasoned professional, you'll have a great appreciation for the fact that we offer an outstanding clinical program. You will have the opportunity to pass your knowledge on to new staff members and continue the process of lifelong learning.
Nowadays, through the health authority, the opportunities are there that one could be immersing oneself constantly in educational opportunities, not just through the health authority, but online webinars and things like that are associated with initiatives that VIHA is striving towards, such as medication reconciliation and such as prophylaxis of venous thromboembolism.
VIHA, I'm very excited to say, is leading the way in smartphone technology at the bedside. All of our sites are wireless technology everywhere, so pharmacists can actually do FaceTime between each other as they transition care of patients between pharmacists. As well as we have drug databases on there to provide point of care information when you're at the bedside chatting with a patient, in rounds talking to clinicians. There's dosing calculators, a variety of different resources that are out there. Having an organization and working for an organization that embraces the technology is a very, very exciting thing.
Here's the offer: a meaningful, valued role at the core of an integrated healthcare team. Infrastructure support and a significant investment in emerging technology considered to be on par with the best in North America. Systems and practices in place, including pharmacy assistants and technicians, all designed to ensure you are able to focus on your work with patients. Constant professional development through off-site courses, conferences, and working with students and residents. And there's one more thing. Vancouver Island is one of the most beautiful places on the North American continent. The incredible majesty of the Pacific on the west side and the beauty of the Georgia Strait on the east frame mountains and rainforest, a truly unique ecosphere. Thanks to the warming currents of the Pacific Ocean and the protection of the coast mountains, the Vancouver Island region has the mildest climate in Canada, making it an extraordinary place to live, to raise children, and to be fully engaged as a professional in a career where your value on the team is given the highest regard.
It's a great place to raise children. There's a lot more time for recreation.
There's lots of opportunities for various positions in our health authority, whether you're interested in direct clinical patient care, pharmacy informatics as an option, home and community health care. So there's so many different areas that you can practice as a pharmacist within VIHA, as well as any location on the island. There's multiple opportunities up and down the island.
Whether you want a small rural site where you can live in the country and work at a small hospital, or you want an urban site that is a tertiary care teaching center, we have it for you. We have everything in between. And when you add in the beautiful environment, it's the absolute perfect place to live.